It's just me today. I don't have a facilitator with me. So if you do put anything in the chat, I might not be able to see it, but we can pick it up hopefully towards the end. So I'll just introduce myself. So I'm Marie Hunt. I'm a Health Programmes Officer at the Council for Disabled Children. I'm sure you've all heard of me and have had emails from me about the national events in the past. I've been project managing them for about 3 years. And this was actually my last one because I'm just giving that task to somebody else. So I feel like I've done my time with that now. They're amazing, but quite stressful to organise. But this is my first time presenting a workshop at one, which is really exciting. And this is a piece of work that I've recently done that I'm really, really passionate about. I'm really interested in gendered health inequalities. So I was very excited when I was asked to do this piece of work. So we're going to be talking about the role of annual health checks in addressing sexual and reproductive health issues experienced by women and girls with a learning disability and/or autism. So quite a mouthful, but we'll talk a little bit about the context of the report, the method, our findings, and some recommendations, and hopefully we'll have a little bit of time at the end to talk as well about the findings. It would be great to know who you are today. So if you'd like to introduce yourself in the chat and maybe just let us know why you've come to the workshop today. So what your particular interest is in this work, that would be great. I'll move on. So a little bit of context. So CDC are the strategic partner to the Learning Disability and Autism Children and Young People's Programme at NHS England. And as part of our contracts with them, there are 2 strands around health inequalities work. So the first one is around stamp and the over-medication of this cohort. I haven't been involved in that work, but it looks really, really interesting. And the other strand that I have been involved in is around annual health checks, specifically through that gendered lens. So looking at annual health checks in relation to sexual and reproductive health issues for women and girls with a learning disability or autism. And the output of this piece of work is a report for NHS England with recommendations looking at how annual health checks could better meet the needs of these women and girls. So just to point out that we know that there is concern that take-up of annual health checks is currently very low amongst young people. We do know that, we are aware of that. This report doesn't look at that issue. Our participation team at CDC have actually done some work for NHS England with children and young people and asking them about their experiences and their attitudes towards annual health checks. So that's kind of where that work sits. But just to point out, we are aware that that is an issue that needs addressing. So why is this work important? Why were we asked to do it? So we know that people with learning disabilities and autism can often experience worse physical and mental health outcomes and die younger than other people. And this is partly why annual health checks were introduced in the first place, to address some of those issues. So women and girls can actually face a double disadvantage when it comes to health inequalities due to both their disability and their gender. So for example, data from NHS Digital suggests that on average there's actually an 18-year lower life expectancy for females with a learning disability than your general population, and that's compared to a 14-year lower life expectancy for males with a learning disability. Now, neither of those statistics are acceptable, but it's obviously very clear that there is a 4-year difference between females and males with a learning disability. That's very apparent, and that is a lot, 4 years. And also there's been lots of focus over the past few years on sexual and reproductive health issues that affect women and girls more generally, and that's been very welcome and very long overdue. So I'm sure you've seen lots coming out in the news, on social media, in parliamentary debates around issues like the menopause, around periods and the tampon tax and the cost of period products, the effects of periods on sportswomen. That's been in the news quite a lot recently, around childbirth, the general lack of research and funding into quote-unquote women's issues for conditions like endometriosis and polycystic ovary syndrome. So these are things that are actually quite common and can have a hugely negative effect on women's lives. And this is all telling us that many women and girls experience a lot of challenges related to their sexual and reproductive health. And that's going to be no different for women and girls with a learning disability or autism. And of course, that cohort will also have their own specific needs that also need to be addressed. So that's the why. So our key questions that we were thinking about for our report for NHS England. So we wanted to find out what are some of the specific issues experienced by women and girls within this cohort. We couldn't cover all of them. Obviously, it's a very, very broad area, but we've covered some of them. Looking at those issues, are annual health checks effectively addressing them at the moment? And if they're not, how could they better address them? Or should they actually be sitting outside of the annual health check, perhaps in education or with other services? And also what needs to happen next to implement the recommendations? So do we need more guidance? Do we need more training, etc.? So those were our key questions. Our method for the report and for answering those questions. So we did some research of academic literature, and we looked at guides for professionals, so from NHS England and the Royal College of General Practitioners. And we also looked at easy read guides about annual health checks produced by charities and local authorities to kind of see what information is already out there for women and girls. We also ran some focus groups with young women with lived experience. So CDC ran a focus group with 5 young women aged 19 to 24, and they had a mix of autism and learning disability. And we also commissioned Ambitious About Autism to run another focus group with 6 autistic young women aged 16 to 20. So I facilitated in both of those focus groups. They lasted about an hour and a half, and participants were asked the same questions, and we did the same activities via virtual Jamboards online. And we'll have a look at some of what the young women told us a bit later. We also consulted with some expert organisations from across the sexual health, the learning disability and autism and women's sectors, including MENCAP and the Ending Violence Against Women and Girls Coalition. And we also conducted 2 more focus groups with 5 experts in the field of women and girls' health and wellbeing. So people from charities and NGOs, and some of whom were also parent carers. So we spoke to the Sex Education Forum, Joe's Cervical Cancer Trust, the Eve Appeal, the Northwest Training and Development Team, and YMCA Bournemouth. So a real range of people there. So as I've said, this is obviously a huge issue, and there's so much we could have talked about and weren't able to. So we had to set some parameters for our research and define the scope. So as you'll know, annual health checks are currently for anyone aged 14 plus with a learning disability. There are plans to extend them to autistic people without a learning disability soon, and there is an ongoing pilot, which is why we thought it was important to include people with learning disabilities and autism. When we talk about sexual and reproductive health here, we're talking about it in its broadest and most holistic sense. So we're not just thinking about issues like contraception, periods and smear examinations, but also healthy relationships, sex education, domestic abuse, sexual violence, things like that. It's not exhaustive, however, and we don't cover all areas, which we'll go into a bit later. So the report is focusing on girls and young women aged 14 to 25, but we do recognise that that is a great period of physical and emotional change. Lots of things can happen in that age range. There are some legal implications. We know that 16 is the legal age of consent to sexual activity, and 18 is the legal point of adulthood as well. So we do consider that in the report. We also talk about needs and abilities. So we're talking about, girls and young women with a learning disability or autism. They're obviously not going to have all of the same needs and abilities. And we're aware that often it's going to be the young people with the most complex needs who aren't going to be able to engage in the traditional structure of an annual health check, but they're actually going to be those who are most at risk of health inequalities. So we bear that in mind as well. Gender identity. So we're talking about women and girls, but we're very aware that it's important that annual health checks are not excluding people who are experiencing gender dysphoria, and that they're also addressing the health needs of trans girls and women and trans boys and men and non-binary people as well. And we know that this might be particularly relevant for this cohort, as some research suggests that there might be a link between high incidences of gender dysphoria and autism. I think this is a huge topic that's worthy of its own dedicated research report, so we don't touch on it here, but we do refer to the upcoming CAS review report, which will hopefully make some recommendations around changes to the current gender identity healthcare model. And ethnicity as well. So we know that women from ethnic minority backgrounds experience higher levels of health inequality in general. And in terms of sexual and reproductive health, in the UK, they have higher rates of mortality related to pregnancy and childbirth and worse outcomes from breast and cervical cancer. And they're also less likely to be diagnosed with endometriosis than white women. So we're actually looking at a triple disadvantage then for girls and women from ethnic minority backgrounds with a learning disability or autism. Again, this is a huge topic that should have its own dedicated research, so we don't touch on it, but we do refer to work being undertaken by the Race Equality Foundation and Contact in this area. So that's the scope. So we'll go on to our first question. So what are some of the sexual and reproductive health issues experienced by this cohort, and what does the RCGP guidance tell us about them? So in the report, we mainly refer to this guidance, which is a step-by-step guide to health checks for people with a learning disability. And it's kind of the go-to guide for GPs conducting annual health checks. So through our research and talking to experts and young women with lived experience, we've identified a number of different sexual and reproductive health issues relevant to the cohort, and we've themed them under the broad themes of physical health and sexual health and relationships. As I've said, this is not exhaustive, and we will touch on that when we go through them. So firstly, physical health. So there are lots that we could have put here, but these are some of the main things that we came out with. So some of the physical health issues that are affecting women and girls in this cohort are around screening, so breast and cervical, breast and pelvic examinations, periods and menstrual issues, HPV vaccinations, pregnancy and the menopause. So obviously both huge topics. We don't focus on them in this report. I think pregnancy is such a huge area. It should have its own research, which I would be very interested in doing if the opportunity arose. And of course, menopause isn't really affecting this cohort, as we're talking about the 14 to 25 age range. But again, definitely requires further consideration, and we do recommend that in the report. And also some miscellaneous other health issues that we came across that tend to impact women and girls more significantly than boys and men, and which might not always directly relate to sexual and reproductive health, often have a huge impact on it. So things like eating disorders, chronic pain disorders, and urinary tract infections. So what does the guidance tell us about some of these issues? So I don't have time to go through all of the findings, but I've just pulled out a few key bits here. So breast screening is not massively relevant for this cohort. Obviously that happens at older ages, but it's important that all women or adult women regularly self-examine their own breast to understand what's normal for them and to look out for any signs of changes. But we know that this isn't always straightforward for this cohort, who might not always understand the importance of self-examination, how to do it, or how to communicate if they are worried about anything. The RCGP guidance isn't very clear around whether women should receive breast examinations at the annual health check itself. It talks about breast examinations though. The guidance is all age, so it's not clear whether kind of breast examinations or education around breast examinations should be happening at all ages or only at older ages when risk increases. One of the experts that we spoke to did raise the issue of whether breast screening and breast examinations should actually be happening at younger ages for women with learning disabilities and autism than women in the general population due to the issues I just touched on. Again, cervical screening isn't directly relevant as it isn't recommended until after the age of 25. It doesn't seem that it's provided as part of the check itself, but the guidance does say that women should be advised to have one during their annual health check. The guidance doesn't touch on pelvic examinations, but there is another guide from NHS England on annual health checks that mentions that female pelvic examinations may take place in the health check, but only if needed. So probably if there were any concerns or any symptoms. The RCGP guidance does mention the effects of the start of menstruation can cause significant issues in adolescence which need to be addressed early. So things like heavy bleeding, painful periods, increased seizures and cyclical behaviour disturbances. And it also says that premenstrual syndrome or PMS can be more prevalent in women with autism. And that the practical skills required to manage periods can take longer to learn, as well as the appropriate social behaviours. So there is recognition of that. And this isn't mentioned in the guidance, but a participant from one of our experts focus groups recommended that the effects of periods on gastrointestinal issues and bowel habits should be considered during the annual health check. So the guidance from the RCGP does contain a section around this, but there's no link across to menstruation. And we know that research shows that there is an association between periods and gastrointestinal issues amongst women in general. So it does seem like an important consideration, especially due to the prevalence of constipation amongst people with learning disabilities, which has led to hospital admissions and even death in some cases. So could be a consideration. So some more about what the guidance tells us. So in terms of HPV vaccinations, the guidance tells us that women and girls should be receiving these, but we know that research shows us that girls with learning disabilities are less likely to receive the HPV vaccine. So it's not clear whether the vaccine could be administered during an annual health check itself, or whether it would need to be done through a different means. And the guidance does acknowledge that some young people might find injections distressing, and that nasal spray alternatives could be used, such as for the flu vaccine. But the HPV vaccine, as far as I'm aware, is currently only administered via injection. So that does raise the issue of what about those young people with needle phobia, and this is particularly prevalent amongst autistic young people. So how do they fit into the annual health check? In terms of some other physical health issues that impact women and girls more significantly than boys and men, so eating disorders. So research suggests that people with anorexia are more likely to be autistic, and anorexia, as we know, can result in irregular periods or periods stopping altogether. Chronic pain disorders tend to disproportionately affect women and girls. Some forms of which are related to sexual and reproductive health, like endometriosis. Some research shows that adults with learning disabilities were at nearly 5 times higher risk for hospital admission for a urinary tract infection. And also other types of chronic pain like migraines, rheumatological and musculoskeletal pain like fibromyalgia are also seen more frequently in women. So all important things to consider. So that's what the guidance tells us about some physical health issues. So moving on to sexual health and relationships. So the main issues that we came across here through our research and through our conversations with experts and young people were around contraception, sexually transmitted infections, relationships and sex education. and domestic violence and sexual abuse or exploitation. So before we go into what the guidance tells us about this, I think it's important to talk about the right to romantic and sexual relationships. So we all have rights to seek romantic and sexual relationships if we're over 16 and we have the capacity to consent, and these rights are enshrined in law. So engaging in healthy sexual relationships, if that's what's desired, is part of overall good health. So the health service does have an important role to play in upholding these rights. We know that most people with learning disabilities and autism are able to engage in safe and fulfilling relationships, provided they're given sufficient social support and accessible relationships and sex education. However, despite all of this, it was very clear from our research and from our conversations that harmful stereotypes do still persist. So we have a quote here from an expert. He was also a parent carer, who said, "It's a presumption that there's no sex activity for learning disability. I find it so frustrating and insulting to the population to just presume that that won't be a factor." Some of the young people with autism we spoke to also said that they were worried about being infantilized if they wanted to talk to a doctor about sex and relationships. So moving on to what the guidance tells us about some of these issues. So the main focus on sexual health and relationships in the RCGP guidance is on contraception. And it states that contraception should be offered and discussed at the annual health check, both as an option for period management and as protection against pregnancy and STIs. The guidance does recognise that understanding of contraception amongst women with learning disabilities will vary, and that easy read information should be made available. The guidance also stresses that women should not be given contraception because they are thought to be at risk of pregnancy and abuse. Rather, it should always be the choice of the woman herself, and that staff should listen to the woman and support her to access the best contraceptive care. So it really emphasises choice. There's no reference to sexual health screening in the RCGP guidance. This is worrying, as research does suggest that young people with mild to moderate learning disabilities were as likely to have had sex by the age of 19 and 20 as their peers from the general population, and they were also more likely to practice unsafe sex than to have been pregnant. Pelvic examinations, as I've said, can take place if necessary, but it's not clear whether tests would take place during the health check itself, or whether the patient would need to be referred elsewhere, such as to a sexual health clinic. And a lot of the young people we spoke to showed a strong preference for sexual health clinics for STI testing. But research has shown that people with learning disabilities can find it challenging to use those self-testing methods that you can order through the post. So face-to-face options are essential for some people. There are references to many elements of relationships and sex education throughout the guidance, so contraception, period management, and also sexual abuse and exploitation. So the guidance does have a section about looking out for signs of sexual abuse and exploitation. This isn't mentioned in the guidance, but that came up through our conversations and our research. There are some particular issues around attitudes from health and education staff towards people with learning disabilities engaging in non-heterosexual relationships. Some studies have talked about the invisibility of homosexuality in the learning disability community, and that there's even less visibility for lesbians and gay women. So it's always really important that, you know, we're not making assumptions about a person's sexuality. And also this idea around masking, particularly amongst autistic women, came up. So the Sex Education Forum write a lot about this, that there's likely to be a higher level of social masking when it comes to sex education for autistic pupils. And masking refers to the conscious or unconscious suppression of natural responses and to adopting kind of quote unquote more socially acceptable responses and behaviour. And this has been particularly observed in autistic girls and women. So although many autistic pupils might understand the concrete information being taught to them about sex, contraception, things like that. Work around the more abstract things around consent, relationships, and risk and coercion can be quite challenging for some young people on the spectrum. So we need to bear that in mind as well. Moving on with this, according to a 2015 report called Unprotected, Overprotected, young people with learning disabilities and autism are at a higher risk of sexual exploitation. We also know from research that disabled people also experience higher levels of domestic abuse for longer periods of time. That is more likely to be severe or frequent than non-disabled people. So the reasons for this are complex and many, but some reasons that we looked at include poor relationships and sex education, a tendency for staff and parent carers to overprotect women and girls from within this cohort and to not let them learn from experience, women and girls being sheltered from opportunities to learn about difficult topics, not knowing how to report abuse and poor police response, little training for professionals around this, specifically for this cohort, and also a lack of appropriate support services as well. So the guidance from the RCGP does recognise the link between disability and domestic abuse, sexual violence and exploitation, and it does talk about it. Professionals are encouraged to look for signs of the young person being at risk of sexual abuse or sexual exploitation, and it tells them to provide guidance on safety and abuse prevention. And the guidance also emphasises the importance of listening carefully to the views of women around contraception in particular, and supporting them to make their own decisions, whilst also stressing the importance of taking child protection issues and questions of consent into account as well. So that's what the guidance tells us about the issues. So what did the young people tell us? So as I said, we spoke to 2 groups of young women with lived experience, and the aim of these focus groups was to gain a deeper understanding from young people themselves about the importance of sexual and reproductive health issues, and how comfortable the young people would feel talking to a doctor or a nurse about them, who they might prefer to talk to about these issues, and the ways in which they would like to receive help and support. So we asked the participants to rate a number of health and wellbeing issues in order of most to least importance. And there was broad consensus that all of the issues that we talked about were important and that it wasn't necessarily appropriate to rank them in order of importance. But a few young people did tell us that they thought abuse checks were amongst the most important issues. The group then discussed whether they'd feel comfortable discussing the issues with a doctor or nurse an annual health check. So the things they said they would be comfortable talking to a doctor about included their period and any changes to their breasts. In terms of what they wouldn't be comfortable talking to a doctor or a nurse about at an annual health check was sex and contraception, domestic abuse and sexually transmitted infections. There was a lot of concern about feelings of being judged and shamed by doctors, and also wider staff at GP surgeries like receptionists. And a lot of the young people told us they would rather go to sexual health clinics as they felt they were less judgmental. There was an overwhelming preference for female doctors and nurses for all of these checks, so for anything related to sexual and reproductive health as well. When we asked the young people who they want to get advice and support from, they told us they just want to get it from qualified people and they want to be able to get it as and when they need it. You know, there were lots of concerns about long waits for GP appointments. All of the young people told us that it was really important that they were able to prepare for their annual health check. And when we asked them how they would like to prepare, they told us through a wide range of methods. So maybe talking to someone in person beforehand about what the annual health check is going to involve, maybe having websites, social media accounts, booklets, videos, home visits, easy read information, etc. So all things that can help them to know what's going to happen in the annual health check and how they can prepare. And here are just some screenshots of some of the Jamboards we used in our focus groups. So the young people were able to add their own post-it notes with their own thoughts, and it was all anonymous, and we got really good engagement this way. So that were the issues and what the young people told us. So that moves us on to the second key part of what the report told us and what came out of the report, which is what is the role and purpose of annual health checks when we're thinking about sexual and reproductive health issues for this cohort. So based on the issues identified and on our research and conversations, it seems that there are 4 key purposes of annual health checks when it comes to addressing sexual and reproductive health inequalities for women and girls. So the first purpose is around promotion of screening, so breast and cervical. The second is around physical examinations like pelvic exams and breast exams, and the administration of vaccines like the HPV vaccine. The third purpose is around referring to other services that might be more appropriate, so sexual health clinics and domestic abuse charities. And the fourth and really key purpose that came out through our research was around the provision of education and messages, especially related to things like self-examination, cervical screening, and relationships and sex education. All of which should start well in advance of the woman becoming eligible for the annual health check or for certain examinations like the cervical smear exam. So whilst all of these elements are important, we do feel that annual health checks have a particularly important role to play in ensuring that women with learning disabilities or autism are provided with important health information and education on lots of issues that I've just mentioned. So key reflections. So currently the guidance does not explicitly recognise the key developmental changes that happen between the ages of 14 to 25. And as I've mentioned, this is a very wide age range. Lots of changes are taking place. Also related to this are issues around advising contraception for people with learning disabilities. That brings in, of course, child protection issues and the Fraser guidelines when providing contraception for young women under the age of 16. And we know this is particularly important for this cohort who are more at risk of sexual abuse and exploitation. The themes of promoting choice and control were very prevalent in our research. And we know that this cohort are often given little to no choice or control around their own lives, and this very much extends to decisions around, for example, the contraception that they use. Also, the importance of consent. So we know this is a notoriously tricky area. It applies to lots of the issues that we talk about in the report, and that the guidance does urge professionals to consider the principles of best interests and also references the Mental Capacity Act. And consent is, of course, very closely connected to education and the role of education and how they can help here as well. And it's also very clear from the research that professionals, parents and carers must tread a very fine line in balancing the need to protect people with learning disabilities from harm and exploitation, whilst also enabling them to develop healthy sexual and romantic relationships. And I touched on the fact that we all have a right to that earlier on. So finally, that brings us to the recommendations. So based on all of this, we came up with a list of recommendations and we split them into 4 categories. So changes to the health check itself, training and resources for professionals, information and resources for women and girls and their families, and further research. So I'll quickly go through each of these. So the young people we spoke to in terms of changes to the annual health check itself talked about the importance of accessibility. So I've already touched on maybe having a female nurse or doctor to perform the annual health check for women and girls as standard practice, being able to bring a friend rather than a parent or carer, and professionals using less jargon and medical terminology, and receiving more training around issues like mental health and autism. Also perhaps co-locating annual health checks in education settings We know that a lot of young people told us that they feel more comfortable in environments that they're more familiar with, so their school or their college, rather than going to a doctor's surgery. This would, of course, require better link up between education and GPs and improved information sharing. An expert we spoke to in our focus group suggested using modelling approaches to annual health checks. So, for example, having female relatives or carers having a cervical exam or a breast exam at the same time as the young person, and other methods like social stories. And also signposting to other services more. So it's very clear from speaking to young people that a lot of them do not have positive relationships with their GPs and surgery staff. Many had felt dismissed, belittled and judged, especially when it comes to sex and contraception. So it might be that signposting young people to other services like sexual health clinics, charities, domestic abuse charities might be more appropriate for them. And of course, that would mean that professionals doing annual health checks need to have all of that information about what's available locally. So in terms of training and resources for professionals, so we've touched on this a lot. We really think that there needs to be gender and age specific guidance from the RCGP that could really drill down on those more complex issues. Also more detailed guidance. So we've talked about the current guidance suggesting that doctors look out for signs of domestic abuse and sexual exploitation, but there's little kind of detail around how they can actually do this. And this is, a big, heavy topic. It shouldn't be approached lightly, and professionals really need the training and guidance to be able to confidently approach these conversations. We don't want it to be seen as a tick box exercise. And more training and resources for professionals on a range of topics like clarity around safeguarding, perhaps having a national forum for practitioners, training around the new relationships and sex education requirements, knowing about local sexual health services, providing reasonable adjustments, and about autism specifically. So information for women and girls and their families. So as I've mentioned, preparation is really key for young people. So they told us they want to be prepared through a range of formats, not just online, because some of them struggle with technology, but some of them told us about NHS England producing a series of videos that could explain what exactly happens during breast checks, smear tests, pelvic exams, etc. Having specific websites and social media accounts, having more detailed easy read guides that are more explicit in what they're telling young people about. Of course, the role of education settings and how they could help. So perhaps teaching about annual health checks and what happens during them during PSHE time. And also perhaps the possibility of having champions in sexual health and well-being in education settings and GP surgery. So rather than having to train all staff in this, having a go-to person who young people could be referred to and who staff could go to with any questions. And finally, further research. As I've mentioned, we didn't talk about pregnancy and associated issues or the menopause, gender identity and race, ethnicity and culture. So we have suggested further research into these areas as well. So that brings us to the end. So a quote from an expert: "Nobody wants these people attending annual health checks to feel that it's a tick box exercise. It has got to be meaningful. And ultimately, annual health checks really do have great potential to reduce sexual and reproductive health inequalities for women and girls within this cohort. So they're not just there to check for health and well-being, but to also provide health education and to signpost to more appropriate services to ensure that this cohort are getting their needs met." So by implementing the recommendations made in this report, I really think that annual health checks have the potential to be a meaningful health intervention. So that brings us to the end. I did have a question, but we have reached the end. So I want to make sure you guys get your break before your next workshop. But I will stay here for 5 minutes if anybody does have any questions. I'm really, as I said, really passionate about this work and I love discussing it. So I've put my email address there if you do want to email me with any kind of thoughts or reflections, or if you'd like to chat further, then I would be really keen to do that. But thank you so much for joining. You've got a 8-minute break, so your next workshop will begin 5 minutes later, at 12:55, and you should have the link to that. Let me know if you don't, and I can get you sorted. But thanks so much for joining, and I hope you enjoy the rest of your day.
Marie, hi.
Hiya. Just
Hi.
that comment in the chat from Tanita, yes, I will share the slides for this. I'll send around the link to those.
Thank you, because I think probably jumping on Louise's bandwagon, we're doing quite a lot on health inequalities in the Midlands, and it will be really interesting to get those slides and just to further ignite that conversation. So
Absolutely.
really keen as well, especially with race and ethnicity even more so.
Yeah.
But yeah,
absolutely. Snake, I wonder whether, Marie, we invite you to Lorraine Mulroney's regional meetings that we have with the regional leads, because I think we're doing it, everyone's going to be doing it, and I just wonder if that would be. But I'll be in contact.
Idea,
is that
Louise.
Yeah, I think that would be really beneficial if you're happy to do that.
Yeah,
and just come
I'd love to.
And talk it through. So I'll send you an email anyway. I best go and have a break because I've not moved yet. So yeah, thank you so much. Really interesting. Thanks very much.
Bye-bye.
Take care. Bye-bye.